Welcome to the Patient Guide for Spine Surgery at Bon Secours St. Mary's Hospital. My name is Cynthia Early, and I am an orthopedic nurse navigator at St. Mary's. My role is to work with all of our spine surgeons and their offices to make this process as smooth as possible for you. If at any time you would like to contact me with questions or concerns prior to surgery, you can use this telephone number or email address. In selecting St. Mary's, you have chosen a facility that successfully performs over 500 spinal surgeries every year. Our nurses have been awarded the prestigious magnet recognition by the American Nurses Credentialing Center, considered the highest recognition for nursing excellence. As we go through this information, you will see page numbers at the top of the slides so that you can refer to your spine notebook for more details. In this presentation, we will highlight some of the most important information. Your surgery will be very specific to the issues that you are experiencing, and your spine surgeon has created a plan for you. When a fusion is needed to correct spine issues, there will be some restrictions of movement afterward, and most often your surgeon will advise the use of a back brace after your surgery. The purpose of a brace is to support and protect the spine while the fusion is healing. Your surgeon will determine the best type of brace for you. You may be given an appointment to be fitted for that brace before surgery, or you may be fitted at the hospital after surgery. In order to prepare for surgery, your spine surgeon may instruct you to see your primary care doctor or other specialists. In addition to those appointments, you will be called by the pre-admission testing department at St. Mary's to schedule some testing and an interview with a nurse a week or two before surgery. As you prepare for your procedure, you want to be in the best possible health to lower your risk of complications during and after surgery. Elevated blood sugars increase the risk of infection and can slow the healing process. So, you will have an A1C blood test to evaluate your blood sugar status. The professionals at the Program for Diabetes Health are available before surgery and at the hospital to help you manage this important issue. Eating a healthy diet of lean protein, fruit and vegetables, and whole grains will improve your recovery. For the best recovery after surgery, we want you to be in the best condition before surgery. It is vitally important to stop smoking and to manage any medical concerns such as blood pressure, respiratory, or cardiac issues. A yearly flu vaccine is always recommended. Cutting back on any opioid pain medications before surgery helps with pain management after surgery. And staying as active as possible also improves your recovery. It is important to be well hydrated, and drinking extra water the day before surgery can help. You can continue to drink clear liquids in moderate amounts. That would be about 12 to 16 ounces, up until 1 hour before you are told to come to the hospital. Clear liquids can include water, pulp-free juices, and coffee or tea as long as you do not add any milk products or powdered creamers. Reducing the amount of bacteria on your skin is a good way to reduce the chance of infection after surgery. Taking a shower with soap and water every day for 2 weeks prior to surgery is recommended. You will be given 2 bottles of an antibacterial agent called chlorhexidine at your pre-admission testing appointment. You will also be given specific instructions for how to use it the night before and again on the morning of surgery. As a service to those who travel more than 30 miles to have surgery at St. Mary's, there is a guest house available to those who may need to drive to Richmond the night before surgery. Also, your friends or family can stay at the guest house while you are in the hospital. You can speak to your surgeon's office, your nurse at the pre-admission testing appointment, or contact me if you would like a referral to be made for you to use the guest house. After this presentation, we will have some review questions like these for you to answer. Question 1. Managing your blood sugar and eating a healthy diet are examples of ways to get your body surgery ready. Question 2. A daily shower for 2 weeks prior to surgery is recommended. Question 3. You will be given chlorhexidine to use the night before and the morning of surgery. The length of your stay in the hospital depends on the progress that you make after surgery. Our goal is to prepare you to recover at home, but some individuals may need to go to a rehabilitation center before they are safe to go home. Please discuss your situation with your surgeon ahead of time. There will be a care manager at St. Mary's who can assist with arranging home health services after discharge if needed. But anyone going home also needs a friend or family member as a coach to support you as you recover at home for at least 1 to 2 weeks. There are many suggestions in your notebook on pages 12 and 13 to prepare your home for a safe return. Some reminders about packing for the hospital. If you have a brace before surgery, please bring it with you. Everyone should also pack a soft t-shirt to wear under the brace so that the brace never touches your skin. If you use a CPAP machine for sleep apnea, please bring the CPAP and your mask to use in the hospital. Finally, you may want to have a credit or debit card with you in case you decide to purchase medical equipment at the hospital, for example, a back kit, which we will describe to you later. Or perhaps as a convenience, you will want to fill your surgery prescriptions at the hospital pharmacy before you discharge home. On the day of surgery, refer to the instructions that have been given by your physician or at pre-admission testing as to any medications that you are supposed to take or not to take on the morning of surgery. Remember to use the chlorhexidine as directed and to stop drinking clear liquids 1 hour before you arrive at the hospital. The admitting office is directly on the left as you come through the front entrance of St. Mary's, which faces Bremo Road. After taking care of paperwork at admitting, you as a patient will be escorted to the preoperative area to prepare for surgery. You will have an opportunity to speak with someone from anesthesia before your surgery. If family or friends will be staying at the hospital, there is a surgical waiting area on the lobby level with complimentary Wi-Fi and a volunteer desk where families can get updates about when surgery is over and when the patient is able to leave the recovery room. When you are cleared to move from the recovery room to your hospital room, your family will be notified of the room assignment. The Spine Center at St. Mary's is 5 West, where you will be cared for by nurses who are specially trained in the needs of spine patients. There are 21 private rooms on 5 West. If there are exceptional circumstances when the hospital is very full, such as during a very active flu season, 3 of the rooms could be temporarily converted to semi-privates. Visiting hours are very liberal, but there are quiet hours in the afternoon and at night so that patients can have an atmosphere of rest. Cell phones are permitted to be used on 5 West. Once you are on the spine unit, we will continue to monitor your vital signs frequently, provide intravenous fluids to keep you hydrated, and check your dressings. You may have a catheter and a drain, but if this equipment is used, it will be removed as soon as possible. We will be using equipment to improve circulation in your legs in order to prevent the formation of blood clots, and we will show you how to perform ankle pump exercises by pointing your toes and then flexing your ankles. Doing 10 ankle pump exercises every hour is very effective for circulation. You may receive medicines after surgery to help manage pain, stool softeners to prevent constipation, or antibiotics to prevent infection. As new medications may be given, your nurse will let you know about the purpose of these medications and any side effects that may be associated. You will also be shown how to use an incentive spirometer to make sure that you are taking deep breaths and keeping your lungs clear after surgery. Our goal is to provide our patients excellent care in the hospital. Your nurses will pass along important information to each other as shifts change. This will be done at your bedside so that you and your family can participate and ask questions. The communication board in your room will be used to update information that will be useful to you. Staff members will be checking in with you hourly to be sure that your needs are being met. When you need assistance, you will have two options. You can use the call button at your bedside, which is the traditional way to communicate your needs, but the most efficient method is to use the hospital phone to call your nurse directly. Your nurse will put his or her 4-digit phone number on the communication board. This is important because for your safety, we always want to be with you when you get into or out of bed or the chair. Your surgeon will create a pain management plan that may initially include the use of a PCA, equipment that allows you to administer your own pain medication into your IV by pressing a button. If used, this will be a short-term measure, and you will be transitioned to oral medications that you will be able to take at home. It is important for you to be able to communicate the level of pain that you may be experiencing so that we can address it. The pain scale is a 0 to 10 scale that indicates how you are feeling. The goal after surgery is to keep your pain under control so that you are able to move and walk. More review questions. Number 1, an important exercise to prevent blood clots is the ankle pump. It improves circulation in your legs. Number 2, the best way to contact your nurse is to use the hospital phone and call them directly. Number 3, the goal for managing your pain is for you to be able to move and walk. Physical therapy will work with you daily to achieve the goals listed here so that you will be able to go home safely. Important goals include walking household distances, climbing stairs, completing activities of daily living such as bathing and dressing with minimal assistance, and being able to use your back brace appropriately. Some patients are ready and able to work with therapy on the day of surgery. If that is not appropriate for you, the first therapy session will begin the morning after. Your coach is welcome to participate in these sessions so that they will know how to assist you when you go home. When you are in bed, you will not be wearing your brace. Therefore, it is important to know how to move from a lying down position to a sitting up position without twisting. That process is called log rolling. Bending your knees and rolling onto your side, keeping your shoulders, hips, and knees together as one unit protects your back. When you are sitting on the side of the bed, that is the time to put on your brace. You will be able to practice this with your therapist and your nurses. The process of getting into and out of a car is important to minimize any twisting motions. That is why we recommend that you back up to the vehicle to sit and then try to keep your upper body straight as you lift one leg at a time and turn your upper body as a unit toward the front of the car. During your therapy sessions, you will practice stairs with the use of a handrail and a cane if needed for balance. Many people with back issues have a difference in strength on one side or the other, but this is not true for everyone. If you have a stronger side, your therapist will show you how to use that to your advantage. The phrase "up with the good" is an easy way to remember to move the stronger leg up first to take the most weight. And the phrase "down with the bad" is a reminder to step down with the weaker leg first. The basics of back precautions are referred to as BLTs: no bending, lifting, twisting, or sitting for long periods of time. These basic instructions will be discussed specifically at the hospital, but the general guideline after surgery are no lifting more than 5 pounds and limit sitting to 30 to 45 minutes. With regard to your back brace, the therapists and nurses will assist you to practice how to put on and remove the brace. Remember to bring a soft t-shirt to the hospital to wear underneath your brace. For women, if you have been told that your brace will be fitted at the hospital, bring a bra with you for proper fitting. After surgery, your physical therapist may recommend equipment for you if it is needed. This could include a walker for stability or a raised toilet seat. A back kit is a set of useful tools which allow you to dress yourself even though you have limited movement of your back while wearing a brace. For example, the long handles on this equipment allow you to put your pants or shoes on without having to reach all the way to your feet. This equipment is not covered by insurance, but it can be purchased through the hospital if you choose. This home exercise program is to help you strengthen some muscles for the work that you will need to do after surgery as you recover. We recommend that you try to do the exercises 3 times each day with 10 repetitions of every one. However, if any of these exercises create more pain at this time, you should skip them. The first exercise is the ankle pump, very important for improving circulation in the legs and preventing blood clots after surgery. With legs relaxed, slowly push your feet down and back up as you bend your ankle. You should feel a squeeze in your calf muscle. The second exercise is the quadriceps set or knee press, and the description for how to do this exercise is in your spine book. The importance of these 3 exercises is to strengthen arm muscles that you will be relying on to help you get into and out of bed or chair after surgery. The descriptions for each of these exercises can be found on pages 34 to 35. Occupational therapy, or OT, focuses on helping patients with activities of daily living, such as dressing, bathing, or showering. OT can be really helpful if you expect to have challenges with getting dressed or using your bathroom facilities at home. They can show you how to use the equipment typically found in a back kit, and you can practice with the equipment to help dress yourself. The correct method of getting in and out of bed without twisting your back is called log rolling. Question number 2. Back precautions, referred to as BLTs, include no bending, no lifting more than 5 pounds, nor twisting, and no sitting for longer than 30 to 45 minutes. Number 3. In general, surgeons instruct patients to wear the brace whenever they are out of bed. This discharge checklist is just a summary of what to anticipate in preparation for leaving the hospital. Most importantly, ask questions to be sure that you are comfortable with understanding your discharge instructions, including any new medications and knowing reasons for taking them, as well as the side effects. Also, understanding how and when to change your dressing is so important after surgery. As part of your discharge instructions, your nurse will also review any important symptoms that you should report to your surgeon. These include signs of infection such as fever or concerns about your incision, and a new onset of numbness or tingling in the legs, loss of control of bowel or bladder, a severe headache, uncontrolled pain. There may be other concerns after surgery that should be reported to your primary care doctor. Examples would include problems with blood pressure or blood sugar. Although the goal for a post-surgical patient is to keep you out of an emergency room, an issue such as sudden shortness of breath or chest pain necessitates calling 911 or going to the nearest ER. We thank you for taking the time to prepare for surgery. To complete this education, please click on the link to the spine quiz and complete some review questions. You can contact the Spine Center at St. Mary's through my email or phone if you have any questions or concerns. We look forward to providing you with excellent care after surgery and helping you on your road to a successful recovery.